Tissue factor is a transmembrane glycoprotein involved in the initiation of the blood coagulation cascade following a breach in blood vessel integrity. In many malignancies, including pancreatic, breast, and lung cancer, upregulation of tissue factor is associated with a worsened prognosis. Coagulation factors 5, 7, 10, and 2 are produced by the liver, circulating the bloodstream in biologically inactive forms, and are found in the extravascular microenvironment of tumor cells. Factor 7 combines with tissue factor, forming a complex that converts factor 7 to a biologically active form, factor 7a. Next, factor 10 attaches to the factor 7a tissue factor complex and becomes activated by the proteolytic activity of factor 7a. Following activation, factor 10a is released and becomes associated with the local membranes, factor 5 and calcium, to form a prothrombinase complex. The prothrombinase complex is responsible for activating factor 2, prothrombin, to factor 2a, thrombin. Several transmembrane proteins, known as protease-activated receptors, or PARs for short, are found at the surface of tumor cells. PARs are activated by the proteolytic activity of coagulation factors 7a, 10a, and 2a. Specifically, factor 7a, while complex with tissue factor, activates PAR 2. Factor 2a, thrombin, activates PAR 1, PAR 3, and PAR 4. All of the PARs initiate cell signaling pathways that result in the transcription of messenger RNA in the nucleus of the cell. The messenger RNA leads to the expression of protein products associated with angiogenesis and cell proliferation, two of the key processes involved in tumor growth. When the factor 7a inhibitor, PCI-27483, is administered subcutaneously, it becomes widely distributed across tissues and organs in the body. PCI-27483 directly inhibits the activation of factor 10 and PAR2 by factor 7a. As a consequence of reduced factor 10a formation, fewer molecules of activated factor 2, thrombin, are produced. This leads to lower levels of activated PAR1, PAR3, and PAR4. The reduced activation of the PARs is expected to have an inhibitor effect on the growth of tumors associated with an upregulated expression of tissue factor. In many cancers, tumor-derived tissue factor can circulate in the bloodstream in microparticle. This circulating tissue factor can inappropriately activate factor 7a, which in turn activates factor 10a and the prothrombinase complex. The activated prothrombinase complex generates thrombin, which circulates in the bloodstream and cleaves soluble fibrinogen molecules to form insoluble fibrin molecules. These fibrin molecules polymerize to form a fibrin thread, an initial step in the formation of an intravascular blood clot or thrombus, a potentially life-threatening event. Because factor 7a inhibition by PCI-27483 leads to reduced factor 10a formation and less formation of thrombin, the potential for intravascular blood clot formation in cancer patients is reduced.